Okay, so that's the report that has generated a lot of stir and made people to wonder, how did we get to this point? And I guess part of the issue has been the fact that resident doctors and other health workers within the Lagos University Teaching Hospital, they've gone on strike. I can't remember for how many days now. So let me ask Dr. Omojola, who's the president, Association of Resident Doctors, how long have you been on strike now?
Yeah, thank you very much. Our indefinite strike started on the 2nd of June. That's about 2 weeks ago.
Okay. Now, what are the issues for you? Why are you on strike?
Okay, thank you. The issues are very clear. Number one issue, as had been said in the report, is that we are very worried as doctors working in LUTH about certain policies which directly impact the life of Nigerians. We are talking about pricing of services in the hospital. Certain services prices have been increased to a level that is not within the reach of average Nigerians. And this particular problem is not just a problem.
Can you be a bit more specific? What are
Yes.
these things, if you want to look at it in clear terms, what are the things that you will point to? This is costing too much, that's costing. What exactly are these
Okay,
things?
thank you very much. Let me give examples so that we can understand what I'm saying. Just about over a year ago, suturing of cut, wound, laceration was about 8,000. It went up to 50,000. If you want to insert a chest tube to drain fluid or water inside the chest, the minimum you can pay is 50,000. Sometimes you may have to pay up to 100,000 when you add all the other costs. And sometimes also, when you are talking of cesarean section, from 35,000, it has gone up to about 130,000.
So when you say that, are you saying that patients are expected to make this payment before they're being treated?
Yes, thank you very much. Sometimes there was a policy before we went on a warning strike that patients must pay before they are attended to in the emergency. However, that particular policy has been reversed. Now, these payments, most of the time, patient has to pay before they get those services. Because if you book a patient for surgery or for CS, if it's an elective case, the patient has to pay. But we have discussed with the management concerning emergencies. So that policy of non-payment before you are being attended to has been reversed.
Now,
so
Doctor,
based on our agitations.
Doctor, let me just take you way back. When I was growing up, you didn't really pay as such, especially in LUTH. So people wanted to be referred to LUTH.
Yeah.
When did LUTH become so commercialized?
Okay, thank you very much. You see, the act that established the hospital is very clear. It is for purpose of training, research, and care. Training at both undergraduate and postgraduate levels. So that is the core objective of establishing a teaching hospital of LUTH standard.
Yes.
It is never for profit making. And you see, when patients come to the hospital, they are playing dual role. They are coming for treatment. They are also being used to teach. So when you are using somebody to teach doctors, then you should subsidize the treatment for that person, because the person is indirectly also rendering service to the nation.
Of course.
You need to have well-trained doctors, because when the patients cannot afford the services, then they go to quacks, and then we don't have enough patients to train doctors, which also now start turning out dangerous people into the society.